Aloha, this is a video for anyone that feels like your pelvis might be out of alignment. So, or if you suffer from SI joint, sacroiliac joint dysfunction or misalignment, this is a self-correction and a self-assessment technique that you can use. So your pelvis consists of your ilium, the two sides of your pelvic bones, your pubic bone, and then your sacrum, that upside down triangular bone underneath your low back and between the ilium. So I'm going to show you how to assess if the ilium or the two sides of your pelvis might be out of alignment, and also how to correct the sacrum and the pubic bone. So your SI joint can go out if you kind of step off of a curb or a stair unexpectedly, or if you jump and kind of land on one side. That's typically how it goes out for men. For women, it can go out just because you're loose jointed, incorrect alignment in yoga, anything like that. So here's how you assess it. You'll just need a yoga block for this. You can put that aside for now. You're going to use a mirror, and then you get in front of the mirror, have your feet hips distance apart, second toes forward, distribute your weight equally through both legs. So you'll know it's off if you feel like your one leg is shorter or longer than the other when you're walking. You're going to take your index fingers, find the bony prominences on the front of your pelvis, and then you're going to take them horizontal so it's really clear if one is shorter. And what I like to do is feel the whole bone and then hook right along the bottom wedge of the bone where you feel a little dip and just underneath it. And then that way you know you're on the same spot on each side of the bone. The spot's called your ASIS. Okay, and so just as an example, let's say that the right side was lower. Okay, so the front side of your pelvis is anteriorly rotated or forward tilted. Okay, so it's not going to look like a ton, maybe an inch at the most, but let's say it looks like this. And we want to rotate the right side of the pelvis backward or posteriorly to make it even. Okay, so I'm going to show you the self-correction for that. You're going to come onto your back, 90 degrees at your hips and at your knees, just at the wall. And you're going to, this is a muscle energy technique, so you're going to use your right glute and hamstring to pull the right side of your pelvis backward or posteriorly. Okay, so remember the right side's forward, using the right glute and the right hamstring to pull it back. So you're going to push your right heel into the wall and just isometrically pull your hamstring down so you feel your glute and your hamstring turn on. Just take your hands as a counterbalance and about 20% of your strength, push into the wall and then push into your hands with your left knee. So your left hip flexor and your right glute is engaged. About 8 seconds or so, relax both. You can kind of hold your legs on the wall, totally relax all your muscles. And then you do it again. So about 20% of your effort, doesn't have to be very strong. Okay, right glute, left hip flexor engaged. Relax it again. Okay, and then you do that 2 more times, just about 8 seconds apiece. Okay, and then when you've done that, take your feet to the ground. Be sure not to lift your butt off the ground. Okay, that's a way that can kind of mess things up. So you're going to take your yoga block, place it just between your knees. This is for the pubic bone correction. You're going to squeeze your knees together as hard as you can. You can even do it wide first, 8 seconds or so, and then the narrow part, squeeze. You can do a couple times, okay? So if the pelvis is off, the pubic bone is off too. It's the same bone, okay? And then from there, just roll onto your belly. And to correct the sacrum, you're going to use your glutes. So you bring your forehead just to the ground, and then you're going to lift both legs up and spread them wide to engage your glutes. And what it does is just gaps your SI joint. So it just gaps the sacroiliac joint. Looks like this. Legs up, out to the side, together, and down. Okay? Legs up, out to the side, together, and down. So just like that. You can do it about 6 to 8 times. Usually you will feel a really big clunk if the sacrum was out of balance, and it just takes your glutes, contracts your glutes, and just gaps the whole joint. So if you feel a big clunk, no worries, it's just your sacrum going back into place. And that is how you self-assess and self-correct your own pelvis and SI joint. So I truly hope this helps you. Namaste.